Good afternoon, everybody, and welcome to today's virtual lunch meeting. My name is Alec. I'm the MD for Wound Care People and the Journal of Community Nursing. Today's session is TENA Solutions for Maintaining Dignity in Dementia Care, kindly supported by Essity. And our speakers are Sarah Murray, who's a clinical consultant, and Danielle Parker, who's one of the account contract managers, both from Essity. Sarah, Danielle, you're with us. How are you?
Good, thank you.
Very
Excellent.
well, thank you.
So I'm just going to do a tiny little bit of housekeeping before I hand over. So today, as usual, you can see we're presenting from our homes. So if you have any technical difficulties, please bear with us. Please comment as much as you possibly can. The more you're engaged, the better these events are. And the difference with a virtual lunch meeting and our standard sort of evening Facebook Lives is that we're bringing these to you as an opportunity to learn about products specifically. So we recognize the fact that one of the things missing since this COVID pandemic is the fact that a lot of you have not been able to see reps in the usual way. And so this is our way of being able to bring that content and that education to you. Today's event will count towards your CPD, so we'll be putting links for the certificates at the end of the presentation. As I said, please ask as many questions as you possibly can. I just want to thank Essity for supporting another one of these events. So thank you very much to those. Without further ado, Sarah, Danielle, I'm going to hand over to you, and I will see you back here after the presentation for the live Q&A. Good luck.
Oh, thank you. Thanks, Alex. And again, just like to echo, thanks really to the JCM for allowing us to have this next half an hour, 40 minutes to talk to you, as the title suggests, around dementia, dignity, and the TENA solutions. TENA and dignity may not, or when you think of TENA, you may not automatically think of dignity straight away. Might not be an obvious link there, but hopefully as we explore some of the themes and the learning objectives today, you might see some of the products and how TENA have designed them to maximise people's dignity in care. So for the next 30 minutes, we're going to be thinking about dignity, especially with reference to people with dementia, but dignity is important for everybody. And so we'll have a little look at the definitions of dignity and what it means. We'll also have a look, as Alec mentioned, at the products, and Dan is going to give you a lot of information around the products, how they work, and how they maintain individual skin integrity, and obviously also importantly try and maintain dignity. We'll have a little look at some of the theories, not going into deep around the theories, but have a little look at some of the theories that are out there around dementia care, that think about dignity, and hopefully sort of bring it all together to offer some solutions for people that you may come across and look after. The thing that we always at TENA, we always try and remember, and as Alex said, this is like the lunchtime sessions that we would do, is that the figures out there suggest that 75% of incontinence could be cured or significantly improved if people access the right treatment and the right specialists. But that does leave us with 25% of people who are going to have intractable incontinence and will have to manage it in some way. That might not be disposable products, it might be other methods, as there's a wide variety out there. But when we think about dignity and dementia care, we know that a lot of people with dementia are using our products. When we first decided on the subject, or talked about what we wanted to achieve with this session, we thought about dignity, and I started thinking about the definition of dignity and what it means. You can see on the slides there are definitions there, and it's something that's been research done around, and I think for me the real important part of it is the misunderstanding, or the common misunderstanding that people may make in equating respect with dignity, or dignity with respect. How we talk about people who may hold themselves in a dignified way or speak in a dignified manner. It can give the impression that dignity is something that somebody has to work to achieve. It's something that they have control of, whereas when you really look down into the definitions of what dignity is, it's clear that it's an inherent value. It's something that we all deserve and that we are all entitled to expect, regardless of our race, religion, age, sex, standing in life even. Everybody is born with the inherent value to expect dignity as a human being. When we think about dignity in care, it kind of ups it ups the ante, I suppose, in some respects, because the people that we're looking after may have lost the ability to be able to maintain their own dignity effectively. And so we have that added burden of responsibility to ensure that when we are looking after people who maybe have their dignity compromised, that we're able to do that in the best way possible. I think when I think about learning and the teaching sessions that we do, certainly a lot of my learning is done almost after the sessions and on reflection and thinking about what I've learned and what I've heard. And although we've not been out and about for the past 12 months, we're still doing training sessions, and I still hear myself saying the words about personal care and thinking about what it must be like to have to accept that personal care. It's very intimate, it's very personal, and for some people it will be the only experience of that kind of nature that they've had. And those people, particularly when we're thinking about continence care and personal care, it could be 3 times a day, it could be 4 times a day, it could be every day. And so I think really dignity should be at the heart of care. And we have guidelines in place from the RCN and the NMC and NICE around dignity in care. And that's another of the reasons it's so closely tied with what Essity as a company do, that we just wanted to touch on it as one of the themes of this session. I think I mentioned at the beginning that I would also be sharing some of our experiences. And one particular experience that I wanted to share was the time I spent doing some training with Silvia Hemet Foundation in Sweden. So in 2013, I was one of only 5 UK nurses at the time to undergo the training in the Silvia Hemet Care Foundation philosophy. So Silvia Hemet is an organisation that was set up in Sweden, and it's to promote best practice dementia care. They liken the person with dementia, as you can see, to a house, having that really strong ethical base. It's a palliative care philosophy. It's based on the equal worth of all people, and they don't have care pathways or symptom control pathways as such that you could follow. They really emphasize the importance of the knowing the person and knowing that what you're doing does no harm and that it is coming from a good place. The pillars are there to represent the communication and teamwork and family support, and if anything happens to any of those pillars, then the supporting structure that they provide is likely to collapse. And you can see at the top we've got quality of life, because that's what their ultimate aim is, quality of life for the person with dementia. And when they talked about quality of life, they're talking about the very little things, the small things, a bit like mindfulness now, but I've not heard of it back then. So it might be the smell of a rose. It might be, for a gardener, it might be actually having your hands in soil. It might be a hug. It's the very small things that give us that little moment of joy, because we know with people when they're suffering from dementia, although some of their intelligence or intellect may be stripped away, their abilities may be stripped away by the dementia, the feelings remain and they are strong and they stay with people. So it's often said they may not remember what you said or you did, but they will remember how it makes you feel. And that was really at the heart of this philosophy. So it was thinking out of the box, going the extra mile, really. Some of the stories and the care that I saw while I was over there, it just amazed me. There was nurses that in one particular care home, they had decided they didn't want to give quite as much night medication as they had been doing to help the people that lived there sleep. And they found that for some of them, all they needed was a person lay next to them to settle. They'd slept next to their partners all their life. They'd gone into a care facility and were suddenly expected to sleep in a single bed on their own. And just the presence of another person lying next to them was enough to settle them to sleep. And that feels quite almost difficult care to give, but it's been given on that ethical base to do no harm and with the best in mind. When I came back from the training, and as you can tell probably by the way I speak, I was just so enthusiastic. It was just such a wonderful way to be able to work. And I reflected on it and felt really privileged, really, that Essity as a company had sought this training out and had put us through it. I felt really privileged to work for a company that looks beyond just the products And at Essity, that is what we try and do. So we're looking beyond the makeup of the products to make sure that any innovations that we bring to the table, any products that we bring out, we've got the quality of life for the people who are going to be using them at the heart of it. Danny's going to talk in a moment about some of the Tenor products. And just to say, we were first to market with the Tenor Pants in this country. I've been doing this job for long enough to remember a time before Tenor Pants. And they were brought out with the aim really to improve people's independence, maintain their dignity, and just having a different way to manage incontinence that we had done before them. But it's just as important to know how they work as well as the different styles. So Danny, if I hand over to you.
Thank you, Sarah. It is great to hear about the work that is going on in different parts of the world and not just the work that's going on in our own country. So as Sarah said, the usual products that you all may have seen is the pad fitted inside the underwear, the fixation pants. But for a person with dementia, this can be really challenging, as they may not recognise that they need a product, so they may tend to rip out the product. And this can have a negative effect on a person's dignity. So alternatively, we have the Tenor Pants, which is a fully breathable one piece that feels like normal underwear. It's intended for mobile and semi-mobile users that supports self-toileting. It is a soft, textile-like material which stretches to contour around the person's body, and it has security and confidence. The dual absorption zone and soft anti-leakage barrier gives that extra protection. There are also wetness indicators on the product. So the Tenor Pant comes in a range of absorbencies and sizes. There's the Tenor Discreet, which is 300 mils, and it goes up to the Tenor Maxi, which has an absorbency of 1050 mil. The next video will show how to fit the product. The Tenor Pant is a unisex product. It has a definite front and back to the product. Coloured elastic in the waistband indicates the absorbency in the back of the product. Open the product up, and to remove the product that is already in place, break away at the seams to pull it apart. Always cleanse between pad changes. The new product can then be simply pulled on as you would do with normal underwear. So I'm sure most of you that are watching are aware of the cost that is due to the Tenor Pant. So in 2016, Essity supported a study looking at the satisfaction levels of carers using the Tenor Pant product versus the traditional pad and pant combination. As you can all see, the Tenor Pant results achieves a higher satisfaction level in comparison to the two-piece products. Incontinence is one of the main reasons why people go into a care home, because people cannot cope with changing the products. So if a pant style product stops a person needing social care or being admitted into a residential home, then surely the Tenor Pant can become a cost-effective product. At the end of the presentation, we'll share with you the reference. So hopefully we've been able to show you how the Tenor Pants can have an impact on maintaining someone's dignity in dementia care. I'll now go through how our products protect skin. So at Tenor, we understand the importance of continually evolving and improving our products. And this is never more vital than when we consider the skin health of our users. So in maintaining skin health and integrity, we highlight the following 3 steps. Keep it dry, keep it clean, and keep it protected. So to do this, we've introduced our Tenor Pro Skin range across all of our absorbing and skincare product range, which includes the Tenor Pant that we've just looked at. So Tenor Pro Skin offers triple protectness for dryness, softness, and leakage security. The field dry advanced layer ensures fast absorption of the urine of urine to keep the skin dry in use, and all the Pro Skin products have been dermatologically tested, independently verified, and endorsed by a third-party organisation, the Skin Health Alliance. So the TENA range of products comes in many absorbencies and styles to cater for all levels of incontinence and individual needs, but they all work in a very similar way. The most important absorbent technology is the super absorbent polymers, which we refer to as SAP. The SAP resembles salt or sugar and is specifically designed to absorb and hold liquid in this case, it's urine. The SAP can absorb up to 1 gram of 25 mils of urine and is distributed throughout the product, concentrating in the central area where the urine will first enter the pad. The main component of the rest of the pad is the fluff pulp, and this resembles cotton wool, but is actually wood pulp fibres that are manufactured to be soft and absorbent and surround the SAP to keep the urine comfortably away from the skin. On the reverse of the TENA Comfort, Slip, Flex and Pant ranges, you'll find the wetness indicators that we referred to earlier. These are yellow lines that will turn blue when urine is present in the pad. We recommend that these are checked at every care interval, and once it is seen that 3/4 of all the indicators have turned blue, it is now time to change the product. The next video will show how the field dry layer works, and then following on from this video, Sarah will look into the theories and models of continence care. The field dry advanced layer is part of the ProSkin principles to ensure the user is dry as possible. As the animations show, the field dry advanced layer allows the quick acquisition of the fluid. The top layer obtains the liquid. The distribution layer then moves the fluid across the product for it to be absorbed into the core to protect the skin.
Thanks, Danny. Danny mentioned then at the beginning the importance of having the correct product choice or the appropriate product selection for individuals. And some of the theories around dementia care support this and add some credence to the value of making sure that this is in place when considering products to be used. So the slide you can see, I'm thinking really of Tom Kitwood. In 1997, his book Dementia Reimagined was almost like a trailblazer in how we thought about dementia care. And it always strikes me that I trained then, I was qualified, and I think back and don't really remember that much about dementia care. Maybe I was on the wrong wards, but in 1997, prior to Tom Kitwood's work, it was a very medical approach, and he introduced the social aspects and the behavioural aspects and looking at how people were caring for people with dementia. So his research was based on observation. He was observing carers as they looked after people with dementia, and he identified a set of behaviours that he split into two. Some of the behaviours that he found to be at risk of reducing a person's well-being were on one side, and in this case we've got disempowerment and objectification, and on the other side were the set of behaviours or approaches to care that could enhance an individual's well-being, and we've got facilitation or collaboration. I've pulled just these two out. There's many more, and it's a really interesting read, and looking into his theories, it's very simple. These behaviours that care staff were often displaying were not necessarily deliberate. They weren't deliberately trying to disempower people or deliberately trying to objectify them. It just was the way care had been done and was being done led to the person at the centre of the care, potentially reducing their well-being. So if we think of the positives first, so collaboration and facilitation. Collaboration is exactly what it sounds like. It's working with the person with dementia to ensure that their choices, their preferences and that of the family and their loved ones are taken into consideration. That's not always easy on the NHS, and we appreciate that, but still it's an important aspect when it comes to thinking about dignity and undermining an individual's well-being. Facilitation is about the importance of making sure that people retain any abilities and skills that they have, so that if they are up and able and mobile and able to go into a toilet and access the toilet, then they should be encouraged to do that. And taking that a step further, any products that are in use shouldn't prevent it. One of the things that we always say when we're training is whatever product is in use for the person, it should never make them more incontinent than it would do if they weren't wearing it. And so thinking about the other two behaviours, disempowerment, as I said, probably more than once, I've been doing this job for quite a long time and was around before the Tenor Pants. And the solution then for people who were removing products would have been to put them into an all-in-one pad with tabs on so that they couldn't remove it as easily. And while that addressed the end solution, it stopped the urine from leaking onto clothing or onto beds or people passing urine in inappropriate places. If you think about it, it does actually empower that individual a little bit. People with dementia can't always find the right words. They can't always communicate in the way we'll expect them to. And so disempowering them to almost display their choice or make their choices obvious, just by trying to, I suppose, offer a solution to a problem is not always best for that individual's well-being. And I've put objectification in because I think, as I mentioned, the behaviours were not always deliberate. They were not always deliberate negative or behaviours that were sloppy or lazy. They were all done with good intentions. Everybody who cares with the best intentions, and we know that. But because sometimes the amount of times that people might need to have a pad changed or taken to the toileting, we quite sometimes slip into the terminology of toileting rounds, pad changing rounds, checking rounds, and we're taking that focus away from the individual onto the object or the task. And again, it just runs the risk of making people, I suppose, feeling a little bit like they're on a conveyor belt, a little bit inhuman, and undermine their well-being. So Tenor Pants were designed very much with this in mind, and they're not the only products that Tenor has in their portfolio that have been designed to offer alternative solutions. And think about this a lot when we think about people who struggle to accept personal care. Accepting personal care, not particularly continence care now, but just general hygiene, washes, hair washes, keeping clean, can be really difficult for people with dementia. And when I was thinking about this slide, excuse me, it was clear that you could talk for hours and hours around this subject. There's some amazing ideas out there, solutions, ways of approaching personal hygiene to try and reduce the distress, essentially, for a lot of people with dementia. But the one phrase that stuck in my mind when I was looking into it was that the best solution for reducing refusals of care is to prevent refusals in the first place. And so when we talk about sort of the care, washing, showering, bathing, I think one of the things I'm certainly guilty of is sort of imposing my standards. So is it a wash without water? And at the end result, really, you want the person to feel clean and have their dignity maintained, because that's why you're cleaning them up for their well-being. And if we can't find a solution that involves water that's acceptable to them, then I think we need to look a little bit outside of the box and potentially look to other options that are available to prevent distress and upset. So I'll hand you back to Danny, who's going to give you some information about the products we have.
Thank you, Sarah. Yeah, we do have a couple of alternatives, and one of them is the Tenor Wet Wash Glove. This offers an alternative for full body cleansing, as well as a solution for perineal skin care when changing an absorbent product. They are single use and are easy to use for the caregiver or the individual, removing the need for separate wipes or washcloths to clean and dry the skin. They are pre-moistened with a gentle, no-rinse cleansing lotion. and can be warmed before use to provide extra comfort, especially when using for a full body wash. You may already have a protocol in place as to how to use the TENA wash glove effectively, but if not, then generally it's advisable to follow the routine shown here. Always make sure you avoid the eyes and sensitive areas when cleansing the face. Pay particular attention to all body skin folds. Once the wash is complete, check that the skin folds are dry. If the product is to be used warm, make sure you pay close attention to the warming instructions and always test or check the temperature of the gloves before use. Another alternative solution we have is the TENA shampoo cap. It is an ideal option for those who may be less mobile or unable to access the bathroom regularly to wash their hair without the need for shampoo and water. The hair is left fresh and clean and can be left to dry naturally before being styled as usual. It is a quick and simple to use and may offer an alternative for those who are reluctant to use showers or baths due to the dementia or mental health symptoms. Simply remove from the packet, massage well into the hair for 3 minutes and then towel dry the hair. It is advised to warm the shampoo cap before use. Make sure you pay close attention to the warming instructions and always test or check the temperature of the cap before use. Evaluations were conducted in the UK, and you can see some really positive results in using the shampoo cap with individuals suffering from dementia. Relatives are able to assist with personal care. It's simple to use, have a huge time and workload saving opportunity in comparison to washing hair in the traditional method of cleansing hair in bed. Sarah will now go through the summary of our session.
Thanks, Danny. So one eye on the time, I can see we've nearly used up our 30 minutes, but just recently, as Danny mentioned, we get feedback from people who use our products. One that was told to me recently from one of my colleagues who had got the feedback from a manager of a care home looking after a lady who was very near to the end of her life. I think the phrase they used was that she was quite well to do, and they hadn't been able to address all her care needs by washing her hair. And so used the shampoo cap, washed this lady's hair, and the expression that kind of was passed on to us was that it brought tears to the staff's eyes, sorry. And it just made me stop and made me realise again how fortunate we are to do what we do, and that the products are out there and we can make a difference in really simple ways to people's quality of life. So with the learning objectives, I hope that we have achieved those. I hope you've we've given you a good understanding of how the products work, and a little bit of insight into dignity or our perceptions of dignity and the importance of it in dementia. We're really fortunate that we work in collaboration with a lot of NHS trusts and clinicians. We have a wide-ranging variety of education and support that we can provide. And if you'd like any more information, please do feel free to contact your account contract manager, or there's an email address there if you're not sure who that is. And I'll hand you back now to Alec for the question and answer session. Thank you.
Thank you, Sarah, and thank you, Danielle. Really informative session. I was really interested. I was also thinking that I recently had a broken boiler, so I was having cold showers, and I was thinking one of those caps, a couple of those caps would have been really good for me during that time. Not that I've got the hair for it, but I think they're brilliant products. I've actually seen them at various events and things. We've had loads of questions through, but before we get to those, I just want to remind everybody that as per one of the slides just then, I think Sarah said it, that Essity have very kindly offered to send anybody who wants one a sample pack of some of the products that we've discussed today. And when you download your certificate, there's an option on there to say that you're happy to be contacted and receive the sample pack. So we'll just need you to put in your information there, and we'll send something, or Essity will send something out in the post. So with that done, let's have a look at some of these questions that we've had come in, because there's been quite a few people watching and lots of chat going on. So the first question, this is for the both of you. This is, what are your thoughts on TENA with regards to waste? I'll start with you, Danielle, if that's all right.
Yeah, absolutely. It probably is a two-pronged question, this one. So from a company perspective, we have set out to reduce our carbon footprint by 50% in the next up until 2030 is our aim. So it goes quite well with what Joe Biden and Boris Johnson have been saying. So we're moving all of our manufacturing plants to 100% renewable energy. So we're trying to cut our waste down as much as possible to support the planet. It's a really important issue to Essity. Sarah?
Yes. Sarah, anything you want to, I mean, I think you've covered it there. Anything you want to add, Sarah?
I think just from a very simple perspective, really, in a clinical perspective, I think I've said it about 4 times, getting the right product on the right person with the right care intervals, the right changing routines, and sort of the education that we offer around supporting people to be able to do that means that we can reduce that waste on a local base, a sort of more local level, really. That's all I'd add.
Yeah, I actually, we haven't talked about this, but I actually have been speaking with some of your colleagues from Essity around sort of sustainability and things like that, because as a business, we do as much as we can. We went plastic free a few years ago, and we've been planting trees for every delegate that attends our events and things like that. And I thought we were doing all right, but actually after seeing what Essity are doing and the steps that you've been taking to sort of make yourselves as sustainable as possible, it's really impressive. And I'm actually catching up with them later today to have to carry on that conversation. So,
Alex, sorry, anyone that wants to read more into our sustainability, by the way, the website is tenor.co.uk/sustainability. If you want to read more.
Yeah, we'll see if we can get that link up on the screen. But yeah, definitely go and have a look at that, because it's all very impressive, all of the stuff that you are doing. So so well done. Question number 2, this is for you, Danielle. This is from Judy, and this is, can TENA pads be used as a continence aid to sit on whilst in bed or chair, or does this practice increase the risk of skin damage?
Absolutely. I think she's answered it within a question, actually. If you just put a product on a bed, if you just lie it on a bed or on a chair, and I think she means the 2-piece system, if you don't use the fixation with it, unfortunately, it is highly likely that product will leak. It does need the TENA fixation to put that product correctly on a person, so then it will absorb the urine and no leakage. Unfortunately, if the product does leak, it can lead to skin being affected.
Okay, thank you. There's another question. This is from Julie. Are there a super absorbent option available for nights or heavy flow? Either one of you want to take this? Danielle, perhaps?
Sarah, I'll hand it over to Sarah. So the clinical consultant, you go for that one?
Yes.
Okay, yeah. Yes, absolutely. The absorbencies of the products go right up to around about 1,600 mils for the most absorbent pads that we would manufacture. We have to have a balance between having that high level of absorbency but still the comfort and the dignity. The products can get quite heavy in use, and so as they need to be body worn, they need to well support. So there is kind of a limit, but for most people the level of around about 600 mils would be adequate for overnight or for long periods of time.
And is there sort of a standard amount that you'd be measuring of what I guess there's not. What I was trying to think is whether there was a standard amount that people would actually urinate, and that's how you'd base what type of product. But I guess that's dependent on size and how much liquid you've had taken in? I think I'm answering my own question here, so sorry.
Yeah, no, it does. I mean, you would say that most a normal adult bladder would hold somewhere between about 300 to 500 mils, and the kidneys produce around about 1 ml a minute, but it's very dependent on how much fluid is taken in at the time and how it's taken in. If we drink very fast, the kidneys tend to kickstart and flush that out quicker. So it's a lot more to it, I think, than perhaps we think about initially. But yeah, basically it's how much you drink. What goes in for most people is what comes out.
But ultimately, the question about whether there are super absorbent options, the options that you've got are more than adequate to cover what would be a typical, typical flow. Okay, excellent. So this is another question. How can we get access to TENA shampoo cap/wash glove? Well, firstly, you can get a sample, don't forget. So that's the first thing. And it says, are they supplied by the NHS?
So currently, the NHS don't supply these through the continence budget, but you can tell patients or residents or yourselves or the care givers, they can purchase them directly through TENA Direct. I think we're going to put the link on the message site, but if you think about how much a hairdresser costs, they actually can be a very affordable option for people who can't access going into a bathroom or a shower. So yeah, TENA Direct at the moment is the best place to get them.
Brilliant. And again, all of these links will be available on the presentation, which will be available on our website to download from tomorrow. So anything that we've mentioned today, you will be able to get access to. The next question is for Sarah. This is from Rebecca, and this is, are there any tips for preventing skin damage with incontinence?
Gosh, yeah, certainly, as Danny mentioned before, the first thing is to make sure that the product is always body worn, nice and snug fitting. The products are designed to take the urine away from the skin very quickly, but they can only do that if they are nice and close to the skin in the first place. And then it's just making sure that people are in the right absorbency of product, using the wetness indicators at change intervals to try and determine that, and then cleaning the skin very gently in between episodes of incontinence. Danny's mentioned the wet wash glove. We also have a 3-in-1 no-rinse cleanser, the TENA wash cream, which will gently kind of cleanse the skin, restore some of the moisture that can be taken out of the skin when you're washing repeatedly, and just leave it very, not protected as in a very harsh barrier or a very sort of definitive barrier, but just leave it protected a little bit and in a better condition. Use of creams is dependent on different areas, but we really sort of at TENA, we sort of, and as a clinical consultant for TENA, we come from the angle that prevention is better than cure, really, in treatment. So if you've got the person in the right product, right change routines, and using the right cleansing, then skin problems shouldn't routinely be an issue. I think, is that answered?
Yeah, I think it does quite clearly, actually. Thank you. The next question is from Akende, which is, how often should toileting be done or pad change? Danielle, you're nodding your head over there. Do you want to answer that?
Yeah, so it's all about the individual, really, and understanding that individual. If the person can tell you that they need to go to the toilet, that's when we should be assisting that person to the toilet. If a person, unfortunately, can't tell you when they need to go to the toilet, it's understanding that person. So if they have got dementia, for instance, maybe looking out for any body language signs that tells you that person needs to go to the toilet. So yeah, it's when it's all about that person and when they need to go.
Okay.
I'm sorry, can I just add as well, I think when it comes to pad changing routines, people very often, and I understand why they want to know how long a pad will last at for a length of time or hours or how many a day is needed, and there isn't a black and white answer to that. As Danny said, it's all about the individual, but the thing that I would say from a clinician's point of view and a dignity point of view is that sometimes people tend to feel it necessary to change pads more frequently than it is, because they have the concept that maybe they're leaving people sat in wet pads, and that's completely understandable. But as I mentioned in the talk earlier, it can be very difficult care for people to accept. And so when you're judging whether or not you need to take someone to the toilet or change their product, put the person at the centre and see if it's benefiting them or just sitting into a routine a little bit.
Okay, thank you. Sarah, the next question is for you. This is, how did you go about accessing the Silvia Hemet training?
Yeah, I was really fortunate. It was the company, Essity, we're a Swedish company, and so they became aware of it, and so they approached the Silvia Hemet Foundation initially to undergo that training. I know that when we were doing the training, when we were going through the session, there was nurses in India who had gone through it as well. So they do have an education program. So I would say, although I haven't been on the website for a while, I would say probably that would be your first point of access would be to have a look at that. I can't speak highly enough of it. It was wonderful training, and it's a wonderful place. So yeah, I don't think I've answered it, but hopefully, I think if you go onto the website, there'll be more information.
Yeah, I mean, I think what we'll be doing, don't forget, is that after this, we'll be putting a copy of the presentation up onto our website along with a video, so you can share it with colleagues or watch it back at another time. And then we can put links and things on there, so perhaps we can do a bit of research into that question and put some more information on the website about it once we know. So hopefully that answers your question. The final question is from Jazz. There's another training question, I think, for the both of you, and it's just quite simply, do you offer training?
Absolutely.
Yes. Yeah. We're both nodding. Yeah, I think most of the people that work with the customers, we love doing the training because we know it makes a difference. And so, yeah, absolutely. We offer training around the product use, around skincare, around continence, promoting continence, best practice for assessing incontinence, all subjects sort of related to the field we work in, really.
COVID hasn't got in the way, so we have been delivering virtually throughout the whole year. So to access any training, speak to your account manager, get in touch, because we can still provide training, albeit over virtual at the moment.
Good. That's good to hear. I mean, don't forget, as I said at the beginning as well, really, this is why we launched the virtual lunch meetings, and they've been really successful because obviously, you know, that face-to-face training, without it, just because you can't do it, it doesn't mean it's not needed. So yeah, thank you both for the presentation, and thank you to everybody who's at home or wherever you are, parked in a car somewhere, eating your lunch on your rounds, perhaps. Thank you all for spending the last sort of 45 minutes with us. We do appreciate it. The link for certificates should be available on your screen now. We'll be back on the 6th of May with another virtual lunch meeting called HydroClean, the simple way to debride. So please come and join us for that. Thank you very much to Essity, and thank you to my team, and Sarah and Danielle. Again, well done on today's presentation. It's been a delight. I think that's it. I think that's it. So enjoy the rest of your afternoon, everybody, and we'll see you again soon. Goodbye.